Okay, so only 28% of healthcare marketers actually have a real content strategy, which means that the other 72% are posting and just hoping that something sticks. So today I'm going to give you 5 reasons why those 28% are winning and how you can be one of them. Most healthcare businesses know that they should be marketing online. However, almost none of them have an actual strategy. And I understand because I've been a nurse for almost 20 years and I've worked in the healthcare system long enough to understand that you are busy, very, very busy. And so one of those things like online marketing, especially if you run a private clinic, a private practice, or are running any kind of healthcare brand, I understand that you're busy. Patient priority is number one. And some things like online marketing are not really necessarily things that you're really good at or necessarily trained to do. So today I'm gonna try to help you with some of these reasons why it's effective. And if you like content like this, I will encourage you to follow along as I dive deeper into this subject as we move forward in this series. Without further ado, reason number one, patients are already looking for you. 77% of patients are already using a search engine looking for practitioners and providers anyway. So they're already online looking to book an appointment, and 90% of them will read online reviews if they exist before they even choose a provider. So what that means is if you're not already online and you don't have any kind of online presence, you're doing yourself a huge service. Essentially, you are invisible to those patients that are looking for what it is that you have to offer. So for example, if I'm gonna go on Google and I'm gonna look for family doctor near me and you don't exist, you are essentially invisible. If I go into family doctors near me and it comes up only with an address, but there's no website or web presence, again, you're doing yourself a disservice by not having one. If I'm finding providers online that have reviews, I'm more likely going to look at those reviews before I decide on one of those practitioners for myself, over somebody who's online, might be near me, but doesn't have a web presence and doesn't have any reviews. So if you can have a website, at the very least a landing page, a booking page, somewhere to integrate some Google reviews or some kind of reviews, that will really help with your brand, with your clinic, and its presence. Reason number two, you're losing patients you never heard about. So 55% of patients have walked away, even if it was a recommendation, have walked away from a potential provider based on what they've read online about that provider. So what it means, if your website is weak, if the online presence is old or stale, if there's nothing updated, if there's no current reviews, if you're not using reviews to promote your business, your services, and what you offer, you could be losing patients before you even know that they exist. So think about the last time that you looked at a doctor's website or a clinic website. If it looks like it hasn't been updated since 2015, there's all stock photos, there's no photos of the providers at all, no reviews, how likely are you to stay on that page, or are you going to keep scrolling and do a little bit more search for another provider? So that silent part is one that nobody measures, but it's actually there and it could be hurting your brand. Let's get into reason number three. This lane for healthcare content marketing is wide open, which means it's a wide open gap for you to really leverage, to use to build your brand. Only percent of healthcare marketers are actually using this lane efficiently, that actually have a laid out content marketing strategy. So what it means is almost everyone else in the industry is just guessing, and a real strategy puts you ahead of the competition almost immediately. Try it. You can scroll on Instagram, you can scroll, do a quick Google search, and you'll see that the big hospitals with huge marketing budgets have a lot of attention, have a lot of really nice, well photographed images on their website. Their website is quite robust with a lot of ads and text on screen and those kinds of fancy things that smaller clinics might not necessarily have. And then maybe you have your one-off really good health content creators that are doing really well, but there's essentially almost nothing in between. So that gap in the middle for solo clinics, solo practices, or healthcare clinics, that gap is wide open. Reason number 4 is this: it's a really smart financial move. Content marketing is 62% more effective than traditional marketing and generates 3 times the amount of leads. This isn't just a trend. This is better return on your investment dollars. So think about it. If you put all your money towards one really good ad, once you stop paying for that ad to keep running, all that traffic stops. But if you have a really good explainer video on your YouTube channel or on your social media channels, and you have a really good explainer video that lives on your feed for a really long time, gains a lot of organic traffic, then that's going to be a much better return on your investment and will keep you in search for years to. So same budget, completely different return. Reason number 5 is this: short form content is the fastest lever to grow right now. 72% of patients would rather get their health information in a short form video versus reading text. And for providers that are posting 4 or more times per month, see an average of 29% lower cost per patient. So if you can produce a piece of content that answers the most basic questions, for example, what's going to happen at my first visit to my provider, that piece of content will fill the space that patients might be afraid to ask, but are thinking about it. If you can provide value and that answer to the question that they're already thinking, then you are keeping yourself top of mind and showing your expertise in a way that is not intimidating to the patient. So healthcare businesses this year aren't going to be the ones with the biggest budget that's going to win. It's going to be the ones who have a strategy behind their content. If this video was useful, I plan to go deeper into this space: healthcare content, healthcare marketing strategy, content strategy, and creative strategy as it pertains to healthcare professionals. And if that was interesting to you, or you learned something new, or you felt inspired to look at your website, maybe do some updating or something new, let me know in the comments. Like the video, subscribe to the channel, and I will see you in my next video as we go deeper into this space. I wish you all the best, and I hope to see you soon. Bye.